Thank you for viewing this video. My name is Esteban, your host, and today I am with Miracle Dental Center. Today I have with me Richard Corey, the director of Miracle Dental Center. Good morning, Richard.
Good morning, Esteban. How are you?
I'm doing fantastic. Thank you so much for hopping on this video. And today, if you're watching this video and you're looking for dental services or dentistry in your area, in the areas of Cooper City, we have Hollywood, Miramar, Pembroke Pines, Miracle Dental Center is here to serve you. And today we're answering the question, what kind of insurance Miracle Dental Center accepts? So Richard, let's get right to it.
Thank you, Esteban. Thanks for hosting this. Before I get into the insurance, I want to mention that Miracle Dental Center is in an area that is close to Pembroke Pines, as you said, Davie, Cooper City, Hollywood, and Miramar. It's really centrally located, and I have 8 top dental professionals in the same office. So we're not referring down the street, you have to go here for this and go somewhere else for that. We have the 8 top dental professionals in the one office. So that being said, we get asked often, what type of dental insurance do you take? Let me start by explaining that there are 2 major types of insurance. HMO, which is Health Maintenance Organization, and PPO, which is Preferred Provider Organization. Let me start with the HMO. Each has a wide range of benefits and some limitations that you have to be aware of before you make a choice as to what's best for you. The HMO, or Health Maintenance Organization, typically you are assigned to an office. So the freedom to go anywhere is really not there. You are assigned to an office. And very importantly, there is no out-of-network benefits, none. If you are not in the network, there's 0 coverage. Okay, so that's an important distinction. The fees tend to be lower with an HMO, but you must be careful because the opposite side of that is that although the fees are lower, the patient basically pays for everything. So case in point, you may have a fee that's $800 on a PPO, but the PPO pays 50% of it. So now your out of pocket is $400. That same $800 procedure is only $500 on an HMO, but you pay all 5. So your out of pocket expenses may be higher, in fact, in certain cases with an HMO. There are also some limitations for certain types of procedures that may not be included. And of course, that means that you would refer to what's called the UCR, usual customary rate, which of course would be substantially higher. So you have to be careful with that. One good thing about an HMO is that there is no set dollar amount that you cannot exceed. Okay, with a PPO, which we'll talk about in just a second, there is always a dollar amount that limits your policy. With an HMO, that does not exist. So let's talk about the PPO, Preferred Provider. The big benefit of that is that it provides for in-network and out-of-network benefits, both. So you can go basically to any doctor that you want to go to, but they typically carry a strict dollar amount that does not carry over. So whatever you don't use during that year, you lose. If they give you $1,000 or $2,000 or whatever that number is, once you've used that, that's it. Be careful because patients sometimes think that it's the first $1,000 and it's not. Insurance companies deal in percentages. They say, okay, well, we're going to cover 100% of this type of procedure, but 50% of this type. We don't cover this type. We cover 80% of this. So it's based on those procedures and the use of those procedures to exhaust your yearly allotment. Statistically, back in 1960, before most of you were born, The average allotment for a PPO in 1960 was $1,000 per year. In 2018, many years later, the average allotment is the same $1,000. So it does not go as far as we would like it to go. Now, all plans that are groups are employer based. What does that mean? It means your employer is going to dictate and negotiate on your behalf what is paid and at what percentage it's paid and how much money you're allowed to have. Okay, so you can't really say Delta Dental does this or MetLife does this. It's Delta Dental for Walmart employees is totally different than Delta Dental for Wells Fargo employees. They're completely up in the air until it's negotiated by your employer. So is it 2 cleanings in a year? That means you could do one today and one tomorrow. Is it one every 6 months? Well, that means we'd have to wait 6 months to clean your teeth again from today. 6 months and a day to be accurate. Or is it 2 in a 12-month period? Those are all up for negotiation. And depending on what your employer negotiates, this is what the plan will dictate for you. Are they going to cover crowns? What percentage? Are they 100%, at 20%, at 50%? Everything is negotiable. The better the plan, the more expensive the premium. So it's up to your employer to dictate what that plan will determine. All frequencies, all limitations are done by that. There's something called a replacement clause. A replacement clause means, well, I got a crown on 7 years ago and it broke, so I need a new one. Well, I'm sorry, we can't cover that because your plan has a 10-year replacement. Okay, there's something called a missing tooth clause that is very common. What does that mean? Missing tooth clause means that if you have a tooth missing before you got this insurance, nothing pertaining to that tooth can be covered. If you want a bridge that includes that missing tooth, well, that tooth was gone before you bought the insurance, nothing is covered. And again, this is dictated through your insurance company by your employer. Some of those limitations are, in fact, a little bit bizarre. There's one that says, if you have an emergency visit, we'll cover the emergency visit, but the doctor is not allowed to do treatment the same day. Can you imagine telling a patient, you're in pain, we know you're in pain, come back tomorrow and we'll treat you? We would never say that, but yet this is what the insurance dictates. You have to be careful and adhere to that because the doctor is contractually bound to go by those fees and by those frequencies and limitations. If we don't collect your copay, it's actually insurance fraud because everything is based on this contract that says, okay, this $1,000 procedure, we're going to give our members for $800, but we're only going to pay half of it. Okay, so that's an important concept. If your doctor does not collect the copay, he's committing fraud on your behalf and you're both in trouble. So you should never ask your dentist to do that. At Miracle, we take most PPOs. We take most of them. We do take 2 HMO products, but only those 2. And you can call and ask for the information regarding the specific plans. There's one other type of plan that I wanted to touch on. There's a lot of individual policies which are not employer-based. And folks will rush out and buy them. Gee, I have a toothache. Let me go buy a plan. The problem that you need to look at is they are full of limitations and waiting periods. Because as case in point, you have a toothache, you want to run out and get a plan and either have a root canal or get the tooth pulled. Well, they're not going to cover it. They'll say, yes, we cover it, but you have a 12-month waiting period, an 18-month waiting period. This is critical. And so you need to ask those questions before you decide on a policy. I always say, if you don't like your shirt, don't blame us. You bought it. Well, if you don't like your insurance, it's your choice. That's why ask the right questions before you decide on a policy. If you have any further questions, call our office and our front desk staff. They're experts with the insurance. They'll do everything by the book and they'll do everything they can to make your life easier and get you the best answer and the best use of your coverage. I hope I answered your question. And if there are any further questions, please don't hesitate to call our office.
Thank you so much, Richard. You did answer the question. And for those of you watching, if you are looking again for dental services in the following areas: Cooper City, Pembroke Pines, Miramar, Davie, what else? We have Fort Lauderdale. We are Hollywood. We are here to serve you. Miracle Dental Center is here to serve you. And like Richard said, if you have questions on insurance, please don't hesitate to call. Richard, what's the phone number?
54885-9560. And the children's side is 954-431-3025. But either number can transfer you to the department that you want, and we'll be happy to answer any questions that you may have.
Excellent, excellent. And also you can visit our website, which is miracledentalcenter.com. You can also book an appointment that way as well. Richard, thank you so much for hopping on this video. And if you really did enjoy the video, please make sure to like it, comment, and share it with others. Again, thank you so much for watching.